6:16 right now. It's the start of a new year. Many folks make that resolution to get back into shape. Well, there's a great enthusiasm about that, but some want to start a new fitness program by going all out. Injuries can result because of that, so it's important to start smart. Learn how to get fit safely this new year with Dr. Rachel Coel, the medical director at the staff physician at the Queen's Center for Sports Medicine. Good morning, and our Ask a Specialist. Welcome back.
Thank you.
Welcome back. Okay, why do people get hurt? It sounds like a simple question, but so many of us do when we dive back into exercise.
So I like to call it the 0 to 60 phenomenon, right? That, you know, we take the holidays to let go a little bit, maybe slack a little bit on our diet and how much we exercise. And then we set this great New Year's resolution to get our health back. And we go a little too fast, we go a little too hard. So frequently the injuries come from just pushing too quickly.
Like rapid increase. We shouldn't be doing that.
Right, we should really be progressing gradually, working back slowly into our fitness, but a lot of us will go too quickly in how hard we go, how long we go, what types of exercises we're doing. Maybe we're not experienced in it, so we're not using the proper form or technique.
And proper equipment, but what kinds of injuries do we see when we do that? Because again, people do that, and there's overuse injuries, but what kinds of injuries do we see?
So you mentioned overuse injuries, and that's probably one of the most common things we see, which is when you do go too hard, too fast, trying new things, sometimes those muscles aren't ready for you, those joints aren't ready for you to push that quickly, and so they become overused. And so we see things like tendinitis, or we see things like, some people have heard of shin splints, where the shins start to ache with running too much. So those are the types of things we might see. We might also see back injuries. The other thing we might see are accidents, because if you're not experienced with the equipment, it's something new you're using, or the weight and it's too heavy for you, you might drop it on your foot, or you might lift too quickly and strain your back. And so we can see those sudden injuries as well.
You see some bone injuries as well, I'd imagine.
Absolutely,
too.
yes.
All right, so when starting a new fitness routine, what can we do? What should we do properly? How can we attack this and be smart but still fit?
Well, I think for some people who might have a chronic medical condition like diabetes or a heart condition, they should make sure they've gotten cleared by their doctor first. For those who don't have those types of conditions, they should also just make sure their body's ready. So get the proper equipment, wear the proper running shoes if they're going to start a jogging or walking program. Make sure that they work gradually back up into their fitness. Start slow and go further and harder as time progresses over weeks to months. The other thing that you can do is get a checkup. So one of the things we do at our Queen's Sports Medicine office is we do something called a functional motor screening, which tells us a little bit more about your flexibility from your hips and your core strength, as well as about your balance. So we can go ahead and test those things to get a better sense of whether you have strengths and weaknesses we can work with to help prevent injury in the future.
Start easy, and good technique is important. Maybe can you demonstrate something that so many of us do poorly, and I'm one of them.
Right.
When it comes to just doing a regular squat, but when you're lifting weights or what have you, what can you share with us?
So that's also something that would be done in the functional motor screen, and the concept is to make sure that you're balanced well, so that your feet are shoulder width apart, that you're sort of squared up, that your weight isn't tilted too far, which is one of the most common things people do, is they lean forward, and so they get their back in a bad position. So it's really lowering from the hips, having that flexibility and strength to do that, and getting that back straight as opposed to arching. Some people will keep their arms too forward, and they're again straining the back. And so it's really about being squared up and having the weight over the heels and having the knees properly aligned over the feet.
And getting low is important, but not that important.
Right, getting the bottom all the way to the ground isn't the essential. The essential is maintaining the proper form.
Right, and if you want to learn more about the free functional movement screening, you can get it done. Call the Queen's Center for Sports Medicine and mention that you heard it right here on Ask a Specialist. Free screening will assess your core strength, your flexibility, your balance, and much more. To learn more, go to that number on our screen or go to KH12.com, and we'll have all the information that you need to know. Dr. Coel, Happy New Year.
Hey, Happy New Year.
And
Thank you.
happy exercise and getting fit in 2016.
Absolutely.
All right, coming up on Wake Up Today, volume again picking up on the roads. Tizo, have your early drive times if you're stepping out the door, but first.